Hello, everybody. Welcome to video 4 of the Blood Glucose Challenge. So today I'm going to be talking about balancing blood sugar using macros. Okay, so balancing, well, first of all, I'll just mention yesterday, that we talked about in video 3, we talked about, choosing or finding the problematic foods that cause glucose spikes for you, using a spreadsheet and flagging each of those elevated levels. Now, one way to try and resolve this issue is to remove the food. That was my suggestion from the previous video, but there are other things that you can do, particularly if it's not a really huge spike that happens. So what we can do is balance blood glucose levels through diet. This is particularly important for people that are managing diabetes or insulin sensitivity, but I think it's important for everybody, actually. So understanding how to manipulate macronutrient intake, so macronutrient intake being carbohydrates, proteins, and fats, so that can significantly impact blood sugar stability. So the idea being that you may not necessarily have to remove the food completely if you can kind of, tweak this macronutrient intake in a way that's going to help blood glucose. So I'm going to walk you through the most effective way to balance those blood glucose levels using macros. So the first one to talk about is carbohydrates. So first of all, what you want to do is choose complex carbohydrates rather than simple carbs. So you want to focus on whole grains. So for example, brown rice, quinoa. You want to focus on legumes like lentils and chickpeas, fruits over juices. So you still do need to sometimes be careful on how much fruit you're eating, but definitely you want to go for whole fruits with the fiber over fruit juice, and also non-starchy veggies. Okay, so this is where you want to kind of focus. These foods have lower glycemic indexes, which means they kind of provide a gradual release of glucose into the bloodstream, which prevents those spikes that I was talking about. The other thing to note is you want to monitor your portion sizes of carbs. So even healthy carbs can kind of lead to elevated blood sugar if they're consumed in excessive amounts. So make sure you're familiar with appropriate serving sizes. So for example, a typical serving of cooked grains is about half a cup, while for fruits, it should be consumed in moderation, like I said, especially high sugar, high GI fruits like bananas and grapes really need to be careful with those kinds of fruits. Now, as I mentioned with respect to the fruit, you want to pair with fiber. Okay, so you want to incorporate fiber-rich foods into your meals because that will slow down the digestion and absorption of the non-fiber carbs. All right, so high fiber foods are things like vegetables, fruits, whole grains, and legumes. And really what you want to aim for in terms of fiber on a daily daily is kind of around the 25 to 30 gram mark, okay? And that will improve blood sugar control and promote really just general digestive health. On the back of that, complex carbs, that I mentioned, you also want to limit simple sugars. So you want to minimize the intake of refined sugar. So anything kind of found in lollies, candy, pastries, cakes, sweetened beverages, most processed foods, all of those things can lead to really rapid increases in blood sugar levels. So if you remember from the previous video, I spoke about a previous client that ate ice cream, and that ice cream had an impact on blood glucose, not just on that day, but on the following day as well. So it's really important to really limit those simple sugars. Now, proteins. What you want to do is include lean proteins. So you want to prioritize sources of lean protein like poultry, fish, lean cuts of beef or pork, and even vegetarian sources like tofu and legumes. So that protein helps to slow the absorption of glucose, and it also increases the feeling of fullness, which reduces the likelihood that you will overeat. Okay, so just pairing protein with any carb that you eat is a huge, it can really change, the blood glucose measurement that you'll see. So, for example, if you're going to eat an apple, it's a good idea to eat an apple with a little handful of nuts, or a little piece of chicken or something like that to really offset those carbs. Now, another thing is you want to balance your meals, okay? So you want to strive to include protein in every meal and every snack. So this can be particularly effective in stabilizing blood sugar levels. So as I just mentioned, a piece of grilled chicken with a salad that includes chickpeas and a variety of vegetables, or maybe you have coconut yogurt with nuts and berries as a snack, okay? So really trying to balance those meals. Another thing is you can consider plant-based proteins, not just animal-based. So incorporating those plant-based proteins can also be beneficial. So things like beans, lentils, quinoa, nuts, because they not only provide protein, but they're also often packed with fiber and other essential nutrients, which is great as well. Then talking about fats, the other macro. So you want to definitely focus on healthy fats. So things like avocados, nuts, seeds, olive oil, fatty fishes like salmon and mackerel. And those fats can then help to slow down the digestion of carbohydrates, similar to the protein that I just mentioned. And that obviously then leads to more stable blood sugar levels as well. You want to avoid trans fats. So basically, limiting the intake of processed foods, because they can really negatively impact insulin sensitivity and also increase the risk of heart disease. So just make sure you're checking labels for hydrogenated oils, and also try to avoid fried foods, overly fried foods. You definitely, this is kind of part of the healthy fats, but just specifically, I wanted to mention omega-3 fatty acids. So omega-3s are found in fatty fishes, flax seeds, and walnuts. And they can also have an anti-inflammatory effect. So that can lead to improved insulin sensitivity. Okay. So, as you can kind of start to see, pairing the macros together, or even better, including all three together. So I call it fat, fiber, and protein. If you can include all three of those at every meal, even snacks, then that's going to be really beneficial for blood glucose. Okay. Now, the other things that can be helpful are meal timing and frequency. So making sure that you're eating kind of at consistent intervals throughout the day can help to maintain stable blood sugar levels. So you want to aim for those kind of 3 balanced meals, and then if you need it, 1 or 2 healthy snacks. Okay, it really depends on your individual needs as to how many of those meals you need throughout the day. Also, I want to talk about balanced snacks. So when you snack, you want to include a mix of macronutrients, just like with your main meals, so that you're keeping your blood sugar steady. So, for example, a piece of fruit with a small handful of nuts, or seed crackers with hummus, and that can provide a balance of carbs, protein, and healthy fats. And the final one I'll mention is hydration. So you definitely want to stay hydrated. It's really crucial because dehydration can affect blood sugar levels and reduce the body's ability to manage glucose. So you want to aim to drink plenty of water throughout the day. And you can also consider herbal teas as an alternative option if you don't like water, or particularly during winter, if you don't like drinking water during winter. So that's it. Thank you so much for joining me.